Anna Kleiner, and I'll be your MC today. Dr. Jeffrey Wainstein will be presenting the Concentra webinar, What Employers Need to Know About COVID-19 Vaccine Administration. Dr. Wainstein is the Vice President of Medical Operations at Concentra. He has more than 30 years of experience in healthcare and is board certified in emergency medicine. He is skilled in developing medical program strategy for on-site initiatives such as on-site vaccine administration. At the conclusion of the presentation, we will have a 10 to 15-minute Q&A session with Dr. Wainstein. You can submit your questions throughout the presentation to be answered during the Q&A. Dr. Wainstein will answer as many questions as possible within the time allowed. A recording of the webinar and the slides will also be emailed to you after the presentation, so you can view them again at your convenience. Dr. Wainstein, we're ready to begin.
Thank you, Anna, and welcome everyone. Thanks for joining us today. We have a lot of information for you, but before we begin, I just want everybody to think back to February 10th, 2020, which was 1 year ago. At that time, the world reached a milestone. That's when the deaths from the SARS-CoV-2 virus, which causes COVID-19, reached 900 deaths worldwide and surpassed the death toll of the previous SARS epidemic in 2003. Now today, 1 year later, on February 10th, 2021, we are close to 500,000 deaths in the U.S. alone, with more than 27 million cases reported since the beginning of the pandemic. But we do have new hope. 2 COVID-19 vaccines are currently available in the U.S., with more on the way. So in this webinar, we'll talk about the new vaccines, provide some insights to help you and your workforce navigate the nation's ambitious COVID-19 vaccination plan. So here's our agenda. We'll begin with a discussion of the vaccine distribution process and the magnitude of the challenge we face. Next, we'll turn our attention to the vaccines themselves and some important clinical considerations that you should be aware of as you make decisions for getting your workforce and yourselves vaccinated. We'll look at some key points you need to think about in preparing a COVID-19 vaccination policy and communicating the need for getting the vaccine to your employees. Finally, we'll address a big question. When can we remove masks, feel safe, and get back to normal? At the conclusion of the webinar, as Anna said, we will take your questions. So let's begin. Strategies for employers to get their workforce vaccinated include 1, partnering with a healthcare provider to hold an episodic vaccine clinic at your workplace. 2, offering vaccinations at an employer-based on-site health center for those who have such a facility. Or 3, by using community vaccination sites where they are established. In this webinar, we will be looking at the approaches you can take and the challenges of each. But first, let's get an overview of the scope of the national challenge in distributing the vaccine. For the past year, the race has been on to get a vaccine, and the vaccines have been developed in record time. And to put this in perspective, vaccines have an average go-to market time of 8 to 10 years. Prior to the COVID vaccines, the quickest a vaccine has come to market was the mumps vaccine, and that took 4 years. So now that we have the vaccine in record time, the challenge is to get it to 1, the high-risk population, including healthcare workers, people in long-term care facilities, the elderly, and those who have high-risk comorbid conditions, and to essential workers, and then eventually to all of us. So the sheer scale of vaccinating the world is daunting. With most vaccines in development requiring 2 doses for full effect, there will be a need for roughly 15 billion doses worldwide to get the immunization we're looking for. A logistics leader has called the COVID vaccination distribution the largest product launch in the history of mankind. Rapid mass immunization has proven challenging for many reasons, including storage and shipping requirements for the vaccines, recommendations for 2 shots within weeks of each other, insufficient governmental and public health policies and infrastructures to deliver vaccines efficiently and equitably, vaccine hesitancy, political barriers to sharing vaccines internationally, ongoing virus transmission, and a shifting sea of coronavirus mutations. We need to continually adapt adopt new strategies to surmount these challenges and keep our hope alive. As someone has said, even on a good day, it seems like the response to this shifting pandemic is like building an airplane in flight. In an article from the Poole College of Management, potential supply chain bottlenecks were identified through computer modeling. And key concerns are listed here. They include supply chain personnel shortages. So not all supply chain personnel are in the first priority vaccination phases, and outbreaks of COVID in these businesses could shut down the entire chain. There's lack of coordination, and some of you might already be feeling this. Each state and even some local jurisdictions have set up different rules for who gets vaccinated first and how the vaccines are going to be distributed. And the lack of a centralized registration system in many areas has set up a scramble for doses. There are potential material shortages. It's not just the vaccine we need, but things like glass vials and rubber stoppers for the vials. Nurses giving the vaccine need alcohol wipes, syringes, needles, masks, gloves, and some of which are in short supply in places. The limited fill finish capacity. This really is the ability to take the vaccine once it's made and get it into the vials that can then be distributed. Vaccine handling requirements and potential damage to the vaccine are a challenge. The Pfizer vaccine requires ultra cold temperatures, and we'll be talking about this in a little bit later. And Moderna does require freezer temperatures during transportation and storage also. So refrigerator and freezer trucks are needed for the movement of the vaccines, and these aren't in huge supply. And the specialized freezers required to store the Pfizer vaccine are not widely available. There are concerning gaps in rural areas where residents have already limited access to healthcare, and there may be more difficulty transporting and storing vaccines in these rural areas. And finally, and not last but not least, misinformation. While not specifically a distribution or supply chain issue, debunking misinformation about COVID-19 vaccines themselves is necessary for the success of the overall effort. So vaccinating as many people as possible, as quickly as possible, is vital to both containing the virus spread and returning business back to normal. Surveys like this one from the Kaiser Family Foundation show that vaccine hesitancy, or the reluctance to get vaccinated, is higher than we see with other vaccines like the seasonal flu. Nationwide, 35% of respondents believe the risks of COVID-19 have been exaggerated. And the problem is even worse in rural areas where up to 40% are not even worried about getting sick. A study by the Institute for Health Metrics and Evaluation showed that only 52% of Americans are willing to get the vaccine, but to reach adequate levels of immunity in the population, or what we call herd immunity, it is projected that we need over 80% of Americans to get vaccinated. So we have some work to do. Whether you mandate the vaccine or make it voluntary at your workplace, you do have an opportunity to effectively communicate to your workforce your concern for their health and the safety of the workplace, and to help dispel the myths around COVID vaccination. Our hope is that this information presented to you today will help your ability to do just that. And at the end of this presentation, we'll share some resources with you, including a CDC toolkit that will help with your communication efforts. I do encourage you to explain the facts to your employees. Don't avoid the conversation, and you probably are having the conversations right now. We know it's on everybody's mind. So let's look at some of the top questions employees are asking. One question we frequently see, not just with the COVID vaccine, but others, including seasonal flu, is will the vaccine get me sick? Will it give me COVID-19? The answer is clearly no. Neither Pfizer nor Moderna contain live virus, and it is not possible to get the disease from the vaccine. Both vaccines, however, do have some side effects that may mimic the disease, such as the development of fever in the day or two after receiving the vaccine, which may be misinterpreted as getting the illness itself. Second question, are they safe? I want to assure everybody on the call that both vaccines do have an emergency use authorization from the FDA and have been shown to meet rigorous safety criteria in the clinical trials this past year that we're testing for both effectiveness of the vaccine as well as safety. Many times people say they're very healthy and they don't need a vaccine, but we have seen that even young and healthy people can get seriously ill with COVID. And even if they don't get sick, they still pose a risk to spread the virus to more vulnerable people in their family and their community and in the workplace. If someone's already contracted COVID, we don't know how long their immunity will last, or for that matter, how long the immunity will last after getting immunized. And further studies are being done to answer these questions. So even if somebody has had the disease, it is recommended that they get vaccinated to prevent a recurrence. So where are we in the rollout process? The first dose of vaccine was given on December 14th, 2020, and as of February 19th, 2021, there are nearly 63 million doses that have been distributed by the federal government, and more than 43 million of these have been administered. That results in a gap of about 20 million doses that are still sitting out there between those delivered and administered, which is about consistent with what we've been seeing through the process. The counts on this slide represent doses, not people, and each person requires 2 doses. Though the Biden administration has set the goal of 100 million doses administered in the first 100 days, or 1 million doses per day, this initial goal has increased to 1.5 million doses per day, which we've nearly achieved, as the current average rate of administration of vaccine in the last week is just under 1.5 million. It's 1.49 million doses per day in the U.S. We currently sit at about 9.9% of the population having received at least 1 dose, so they're partially immunized, and 3% of the population being fully immunized or having received 2 doses. And remember, the goal here is immunizing at least 80% of the population, so we have a ways to go. You can stay informed on vaccine distribution tallies if you're interested by going to the link shown here on the slide where the CDC reports the numbers of vaccine doses distributed and administered. The numbers here are updated daily. These are as of yesterday, February 9th. And you'll find other good information on this website as well if you're interested. So now that we have a sense of the challenge before us and where we are in the effort, I'd like to talk about the process in place. Currently, the federal government acquires the vaccine and distributes the vaccine to the states. Many states are then using their county health departments to distribute the vaccine to their approved vaccine providers in the state. Breaking news report that the federal government will start shipping vaccines directly to community health centers next week. They have not done this before. And this is in an effort to speed vaccinations and ensure doses are reaching vulnerable people. Bypassing the state government, the federal government will ship doses to 250 centers nationwide, selected based on their proximity to vulnerable groups such as homeless people and those with limited proficiency in English. So things keep changing week to week. The CDC has created recommendations, guidelines, tools, and resources to help with the effort. So let's take a look at what they're doing. And we'll look at some key points of the new administration's vaccine plan. And finally, in this section, we'll look at some of the institutional tools the CDC uses to track vaccine distribution and to monitor the vaccine safety. So at the end of 2020, in December, the Advisory Committee on Immunization Practices, or ACIP, issued recommendations for vaccination allocation for each of the vaccines. You're probably familiar with the phases identified and recommended by ACIP. They prioritized healthcare workers and long-term care facility residents first in phase 1A, followed by other frontline essential workers and people over 75 years of age in phase 1B. It's estimated there's about 49 million people in phase 1B. Next were adults 65 to 74 and anyone with high-risk conditions, and all other essential workers. They're in phase 1C, and there's estimated about 129 million people in this phase. Once this phase is complete, it would be followed by, in phase 2, by everybody else. These are just guidelines, and states and counties are not only modifying these priorities, but have different definitions of essential workers and may be in different phases of distribution, depending upon the availability of vaccine in their state or area. Again, this causes a lot of uncertainty and some level of confusion with folks trying to obtain the vaccine and administer it. At this time, at least 43 states have expanded their occupational-based vaccines to include some non-medical essential workers, meaning moving into phase 1B and 1C, and including workers like police officers, grocery store workers, in addition to the healthcare providers. As I said earlier, the goal set by the new administration is 1.5 million vaccines per day, but most experts think that this number is too low and really needs to be closer to 3 million per day, double what we're currently at. At the current pace, only about half of the total population will be at least partially vaccinated or with one dose by mid-July, not until mid-July. And we wouldn't reach our goal of 80% vaccinated until late November. And none of us wants to wait this long. The administration now says that there will be enough vaccine by summer's end for 300 million people to get vaccinated. In the new administration's plan, the priority groups are going to remain the same, but to maximize the rate of immunization, they're proposing, among other things, to establish 100 FEMA vaccination sites across the country, to create mobile vaccination clinics, and to use the Defense Production Act to expand both vaccine supplies and production. On January 29th, just last month, OSHA issued employer guidance that has no new legal requirements, but highlights the 5 essentials for prevention of transmission of COVID in the workplace. I hope you're all familiar with this. They are recommending that all employers do the following, many of which you probably already have done. These are conduct a hazard assessment in the workplace, identify control measures to limit the spread of the virus, adopt policies that don't punish employees for missing work due to isolation or quarantine requirements, helping to reduce barriers for potentially infected employees to stay home. To ensure COVID-19 policies are communicated in the employee's language, and to implement protections from retaliation for employees who raise COVID-19 concerns. There is a mechanism in place to track where vaccines are going and to monitor safety, including tracking of all the adverse reactions that are occurring. The vaccine tracking system, or VTrckS, you may have heard of it. It was completed in 2013 and has been in use since then. It's a web-based vaccine order management system from the CDC. And VTrckS is currently being used for almost 80 million doses of various vaccines given each year, to track the vaccines allocated, distributed, administered, monitored, and providing reporting. For COVID, it allows the 64 state, local, and territorial public health jurisdictions and the federal agencies receiving direct COVID vaccine allocation, including the Departments of Veteran Affairs, Defense and State, the Indian Health Service, and the Bureau of Prisons, and enrolled national provider organizations such as pharmacy chains. It allows all of them to both view vaccine allocations allotted to each program, place and manage vaccine orders for their providers. Once the orders are received, the federal government then authorizes the order through the system and sends the order to the manufacturer, who then ships the vaccine directly to the provider. The system allows for tracking of these vaccine shipments and then generates reports through the whole process. The CDC also offers 3 other tools that I just want to mention briefly, and these tools are for the recipients of vaccines to help ensure dose compliance and to ease concerns about vaccine safety and side effects. The first one is VaxText, which provides a second dose text message reminder to vaccine recipients and follows up on their post-vaccination health. The second one is vSafe, And this is a tool for the recipients of the vaccines to report side effects. It's also a text message-based system and really quite easy to use. And the third one is Vaccine Finder. This is a website used to identify available vaccination sites for the general public. Though this one isn't currently in use for COVID vaccines, it is in use for other vaccines, and it should be used for COVID once the COVID vaccines become more widely available. So I've mentioned the two vaccines available today that have received emergency authorization in the U.S., Pfizer vaccine and Moderna vaccine. Both are mRNA vaccines. And as I said earlier, and just want to reinforce, neither contain the live virus. There are 65 other vaccines currently in clinical trials, with 10 that are presently being used in other countries, and several others in late phase 3 trials that are close to being emergency authorized. So new ones will be coming, but today we're going to be focusing on just the two vaccines that are available currently in the U.S. So first, Pfizer. Key points about the Pfizer vaccine. Number one, which has been a big one, is that it has super cold storage requirements that can be maintained in only one of two ways, either by keeping the vaccine in the original shipping container that comes packed with dry ice and replacing the dry ice every 5 days, and this can be done for up to 30 days, or by using specialized freezers that are able to chill the vaccine to below the negative 76 degrees Fahrenheit that's the required. Normal freezers clearly don't get this cold. Adverse reactions to Pfizer are common and they're anticipated. And we will talk more about these in a few minutes, but serious adverse reactions are rare and most side effects resolve quickly. The Pfizer vaccine requires 2 doses given 21 days apart. Each vial contains 5 and maybe up to 6 doses per vial. And the vaccine is authorized for use in adults 16 years of age or above. Currently, there's no vaccines approved for children. Key points for Moderna. The transportation and storage requirements are easier to meet than Pfizer. The temperature requirements are within normal freezer and refrigerator temperature ranges, so specialized equipment isn't needed. Like with Pfizer, adverse reactions are common and anticipated, and severe adverse reactions are also rare, and most of these side effects resolve quickly. It also requires 2 doses given 28 days apart. Each vial contains 10 doses as opposed to the 5 or 6 with Pfizer. And this vaccine is authorized only for adults 18 years or older. So let's just quickly compare the two in 4 areas: effectiveness, storage, temperatures, preparation, and doses. In terms of effectiveness, as I said, both vaccines do require 2 doses, and second dose compliance is critical, but there is some effectiveness with 1 dose. So Moderna is 80.2% effective after the first dose, and Pfizer is about 52% effective after the first dose. But both reach 95% effectiveness at least 4 weeks after receiving the second dose. And this is why 2 doses are really recommended at this time. Storage, as we said, Moderna is much easier to handle and store than the Pfizer vaccine. In terms of preparation, both vaccines do need to be thawed to room temperature prior to administration, but Moderna comes ready to administer, whereas Pfizer must be diluted, again, causing a little more difficulty or complexity with the Pfizer vaccine. And the doses per vial, as we said, Moderna has 10 doses per vial, where Pfizer has 5 or 6 doses per vial. So as we said, both vaccines require 2 doses to be effective. The timing that is recommended for the second dose is 21 days after the first dose for Pfizer and 28 days for Moderna. But the second dose of either vaccine may be given up to 4 days early when necessary and can be given later than the recommended time interval. It is not required to repeat the series if there's a delay in receiving the second dose, whether due to vaccine shortages or other barriers that an individual might encounter. There is even some evidence to suggest that the second dose may actually be more effective when it's delayed. And so this is being studied now. The recommendations currently are based on the original clinical trials. It is recommended that the second dose be the same vaccine as the first dose, but there is a current study being done to address the impact of using different vaccines for the first dose and the second dose, in addition to examining the efficacy of different time intervals between the vaccine injections. So these recommendations on the time intervals and other may change depending upon what we learned from these new trials. So as I said earlier, every vaccine does have side effects, and they're expected, and the clinical trials have shown that these vaccines are no exception. The side effects of these vaccines are common, expected, and generally mild, and generally indicate that the immune system of the body is working the way it should. It's responding to the vaccine. We've seen about almost 90% of vaccine recipients experience one or more local reactions, such as pain, redness, or swelling at the injection site, swollen lymph nodes, and up to 83% may experience one or more systemic reactions. And a systemic reaction is something like fever, fatigue, muscle aches, headaches, nausea, vomiting, or chills. Most of these systemic reactions are mild, as I said. They occur within the first 2 or 3 days of vaccination, with most occurring the following day. They do seem to resolve fairly quickly within 1 to 2 days of onset, and are more frequent and severe following the second dose, and more prevalent among younger people compared to people 55 years and older. Some people may experience side effects so severe that it might prevent them from being able to work. To minimize the impact of these side effects on business continuity and staffing, considerations for employers should include potentially vaccinating individuals on the day preceding 1 or 2 already scheduled days off, staggering the delivery of the vaccine to your workforce, meaning not vaccinating everyone working in one area or in the same job duty at the same time, and providing information to the workforce on the potential for side effects so that they're aware and they anticipate them. Because some of the side effects, such as fever, may mimic an acute infection, there are times that it may be difficult to delineate the two. And strict isolation, clinical evaluation, and even COVID testing may be warranted for some individuals with severe side effects to rule out the possibility of an acute COVID infection. A very small number of people may have a severe allergic reaction or anaphylaxis to the vaccine. For Pfizer, we've seen a rate of about 11 such reactions per 1 million doses administered. And for Moderna, much less, about 2.5 cases per million doses administered. So it does happen, but it is quite rare. This side effect can be life-threatening and is the reason why there's a mandatory 15 to 30-minute observation period after receiving either vaccine. And some people with a known history of severe allergic reaction to any of the ingredients in the vaccine should not receive it. And all recipients are screened for this using a questionnaire prior to receiving the vaccine. So as you take in all this information, I'm thinking that the need for your business to have a well-articulated vaccination policy becomes clear. Over the last year, the pandemic has created stress and anxiety in many of us. Conditions that reduce our ability to listen and reason calmly. So this is why communication of facts, maybe multiple times to your employees, may be necessary. So what should your vaccine policy contain? You can see the 4 critical points here. First, decide whether you're going to mandate the vaccine or make it voluntary. The EEOC has determined that employers can mandate that their employees get the vaccine. If you decide for your organization that getting the vaccine is voluntary, you should consider offering some type of incentive to encourage compliance. The more compliance you can get, the better it will be for your organization, and the quicker we can get back to normal. A survey released last month by a human capital research firm found that almost 40% of businesses have decided to make the COVID vaccine voluntary, but with strong encouragement to get vaccinated, and another 40% are still deciding. Of course, you should consult with your in-house experts, human resources, safety, legal counsel, operations, in developing your policy. And what I've said before is make sure to communicate the policy to your employees while inviting discussion. And of course, it should always be friendly and never adversarial. So let's get to a question employers need to consider. The question I posed earlier is how are you going to get your workforce vaccinated? Are you going to arrange for an on-site event for vaccine administration, or are you going to send your employees into the community to get vaccinated? Some large employers that we work with have their own on-site health centers and are coordinated the vaccine administration through their established on-site. Many large employers without an on-site health center are already planning to hire a provider to run an episodic on-site vaccine event for them. For employers who want an on-site event, the provider you choose to partner with to administer the vaccine must apply to the state to be eligible to administer the vaccine. There are vaccine storage considerations that we've already discussed that need to be addressed, as well as space considerations to maintain social distancing during the event. An on-site event may require specific equipment and supplies, such as an on-site freezer capable of reaching very cold temperatures, dry ice, specialized temperature monitor gauges, and trained medical personnel in the proper handling and administration of the vaccine and the management of the adverse side effects. There are many providers that have experience in providing workplace vaccine events, but given the breadth and scope of the vaccine effort, it may be difficult to secure a provider that is available to perform the service at your workplace. The benefits of having an on-site event are clear and include the ability to immunize a large percentage of your workforce in a limited amount of time, and to reduce the time away from work that your employee might need to wait in line at a community vaccination site. Some community vaccination sites are going very quickly. Others, people can be in line for hours waiting to get vaccinated. Regardless of what you choose, again, it's important to communicate clearly to your employees your policy and plan. So when can we remove our masks and feel safe? That's a big question, and we all want to know the answer. The bottom line, as I alluded to before, is it may be a while, given the pace of this effort. As we get more and more people vaccinated, we do expect to see a reduction in the spread of the disease over time, a reduction in cases, a reduction in hospitalizations, a reduction in deaths, but it's going to be a slow process. Masks, social distancing, and other COVID precautions may be with us for a while, through the fall and perhaps even longer. To keep in mind, too, that the vaccines are not effective for everybody, and about 5% of the population will be non-responders, meaning the vaccine won't work for them. And of course, the people who don't take the vaccine are a consideration, too. So the more people we can get vaccinated, clearly the better. So until we get a critical number of people vaccinated, these 8 practices should continue in the workplace, even for employees who have been vaccinated or This may come as a surprise to some employees who thought the vaccination meant they could discard their masks. But it is wise to be cautious. We still don't definitively know whether vaccinated individuals can carry the virus and transmit it to other unvaccinated people. So whether you're just beginning to develop your vaccine policy and program, or whether you have a well-developed plan in place, I'd strongly encourage you to take a look at these resources if you haven't already. They're very good. Will save you time and resources that would be involved in creating your own materials from scratch, specifically the vaccine communication tool, which is the first one in the top left. There's great resources on that page as well as some of the other pages. We will make the slide deck available to everyone so you can explore these links. And please don't hesitate to reach out to your contact or account manager at Concentra. We're happy to answer questions and provide assistance. Our clinicians have been consulting with our clients over the past year with all kinds of COVID issues, and we're happy to provide the information to you that we can to help you understand what's going on and manage this pandemic. So with that, let's see, do we have time to take a few questions, Anna? And I just want to appreciate you all for attending the webinar and listening so patiently.